Dear Natalia, dear friends in Ukraine, I'm sending my heartfelt wishes that you and your families stay safe and that this terrible war is over very soon. I congratulate you on your strength to organize this meeting, and I thank you for the invitation to be part of it. I would like to present our data on the relationship between bone mineral density and body composition in Serbian population over 65. But before that, just a few info about where I'm coming from. The University of Novi Sad, with around 50,000 students and 5,000 employees, is one of the largest education and research centers in Central Europe. It belongs to the group of the comprehensive universities, and they are characterized by providing nearly all fields of science and higher education. Among them is the medical education. Faculty of Medicine has different programs in all three levels, undergraduate, master and PhD studies, and at this moment 4,572 students are studying in Serbian and 553 studying in English. Teaching base for our faculty is University Hospital Clinical Center with 20 clinics, 9 centers, 1,700 hospital beds, more than 800 doctors and 2,500 nurses and technicians working side by side. I personally work as a rheumatologist at orthopedic and trauma clinic, and my main field of work are osteoporosis, osteoarthrosis, and sarcopenia. My town, Novi Sad, is the capital of Serbian north region called Vojvodina. Population of Vojvodina makes more than 25% of Serbian population, and our biggest problem is that Serbia has one of the oldest population in Europe, and Vojvodina is in the same situation too. We have 51% of female in our population and not that good age distribution as you can see in the graph below. As you can see, 42% of population in Vojvodina are older than 50 years. If we know that one of 2 females and one of 5 men over age of 50 are in risk of fragility fractures, then we can understand that we are dealing with potentially 215,000 female and over 68,000 male patients in the future decades just in a hospital for the region we are covering. Our idea was to do as much as possible to prevent this from happening, so we applied for a special program to our regional health ministry, and we got the clearance to go with it. In 3 months, we screened 700 volunteers, pensioners from our regional pensioner centers, and in a period from April to June 2019, we have done all this to them. SPPB test, short physical performance battery test, DEXA with hip and lumbar spine, total body composition, and with visceral adipose tissue calculated, with then geriatric depression scale, EQ5D, mini nutritional assessment, SARCAF, SARCOL Serbian, mini mental state examination, international physical assessment questionnaire, and a lot of laboratory with vitamin D, P1NP, cross labs, hepatogram, nephrogram, lipid status, electrolytes, almost everything. But I'm not going to present all the data. I'm just going to show you the connections that we found between DEXA scan of hip and lumbar spine and total body composition. In our outpatient department, we have General Electric Lunar Eye DEXA with a lot of additional softwares like TBS, sarcopenia, orthopedic hip and orthopedic knee, fracture risk, FRAX, of course, is integrated too, advanced hip assessment, core scan, and advanced body composition, and we used almost everything for our patients who are coming to our outpatient department to do the DEXA scan. For this research and to our pensioners, we have done examination like this. We have done first the lumbar spine, then the left hip, then we done the total body composition, and we got at the end VAT calculation. This is how our group looked like. We had a majority of female participants in this examination, and the majority of them, 78%, were between 65 and 75 of age. Classification of the T-score was done for the T-score of the spine and T-score of the hip. The criterion we used to classify the overall T-score was the lowest specific T-score. So if participant had, for example, osteopenia of the spine and osteoporosis of the hip, their T-score was classified as osteoporosis, which is the lower score. As seen in Table 1, T-score of the spine was normal in 42.2% of the participants. Osteopenia was presented in the same percent. And lastly, osteoporosis was present in almost 14% of our participants. Looking at the T-score of the hip, normal score was presented for 26.8%. Osteopenia was presented in 58.4% of participants, whereas osteoporosis was presented in 14.8% of the participants. Other variables and parameters that we measured were visceral adipose tissue, fat tissue mass, and lean or muscle mass. The mean values alongside the standard deviation for these variables can be seen in Table 2. Mean VAT was 1.537 kilograms with a standard deviation of 0.82. Mean fat tissue mass was 31 kilograms with standard deviation of 9.152. And lastly, mean muscle mass was 43.735 kilograms with a standard deviation of 7.05. In our analysis, we first explored the relationship between muscle mass and the T-score. Muscle mass we found to be positively correlated with the T-score of the spine, R is 0.472, and with the T-score of the hip, R is 0.346. As the correlation is positive, this indicates that the muscle mass is higher, so is the T-score of the spine and the hip. All of the correlations were statistically significant at the p-level of less than 0.01. After analyzing muscle mass and the T-score as a continuous variables where we looked at the correlations, we were also interested in seeing how mean muscle mass differs for those with a normal T-score compared to those with osteopenia and osteoporosis. A Novi test showed that statistically significant difference does exist between the different groups. The highest mean muscle mass was presented for those with a normal T-score. Slightly lower muscle mass was recorded for those with osteopenia, whereas those with osteoporosis had the lowest muscle mass. Next, we looked at the correlation between the fat tissue mass and T-scores. We found that there was a positive correlation between the fat tissue mass and T-score of the spine, as well between the fat tissue mass and the T-score of the hip. However, it is important to note here that the R values suggested only a weak positive correlation that is highly significant. We also examined if those with a different classification of the T-score, or in other words, those with a normal T-score, osteopenia, and osteoporosis, have statistically significant difference in the mean value of the fat mass tissue. We performed an ANOVA test which showed that a statistically significant difference does exist, and the highest fat tissue mass was presented for those with a normal T-score, where those with osteopenia has slightly lower fat mass, and lastly, the lowest value was presented for those with osteoporosis. Lastly, we also found that there is positive correlation between the T-score of the spine and visceral adipose tissue, as well as between T-score of the hip and visceral adipose tissue mass. Both results indicate that the VAT is higher, so is the T-score of the spine and the T-score of the hip. The results for both correlations were statistically significant. As for muscle mass and fat tissue mass, we also examined how the mean value of VAT differs for those with a normal T-score, osteopenia, and osteoporosis. We performed an ANOVA test that showed us that there are statistically significant differences between the three groups. The highest VAT was presented for those with normal T-score, whereas those with osteopenia had a slightly lower VAT, and lastly, the lowest value was presented for those with osteoporosis. From our results, there are several different conclusions that we can make. Firstly, our results indicate that the muscle mass is positively correlated with the T-score of the spine and the T-score of the hip, and that a relationship is statistically significant. Moreover, fat tissue mass is also positively correlated with the T-score of the spine and the T-score of the hip. Lastly, we observed the same relationship for the visceral adipose tissue and the T-score of the spine and the hip. At the end, I would like to thank you for your attention and to express my sincere hope that we will be able to see each other next time in Ukraine. Thank you. Bye.